Get started here this morning. Thank you again so much for being here, and thank you for bearing with us as we've made a couple of adjustments to our run of show. My name is Joshua Yeager. I am here both representing the Governor's Youth Commission as the Mental Health Workgroup's chairman, and I'm also here as a representative of the ASU Prep High School school system, as I am a student there as well. And I would like to thank you for being here in this beautiful space with us this morning. We're going to go ahead and get started with our panel very soon. I just wanted to let you know that, as you probably saw out there, bathrooms are right out these double doors and to the right. And if you need anything else, just flag down one of our GYC folks and we will do our very best to help you. This morning, we are going to have an amazing discourse about the issues of mental health, substance abuse, and how those correlate with our students, which is an increasingly prevalent problem in our day and age. And now I'm going to hand it off to the Governor's Youth Commission.
Thank you so much, Josh, for the wonderful introduction. Good morning, everyone. Thank you guys so much for coming here today to the Stronger Together event. My name is Cecil Hughes. I'm a proud member of the GYC, or the Governor's Youth Commission if you want to be fancy, housed within the Governor's Office of Youth, Faith, and Family, or GOYFF. The GYC is a diverse body of high school students from across the great state of Arizona, bringing together diverse perspectives to tackle important issues affecting our state's youth today. Commissioners work to identify and address the specific challenges facing our state's youth, with various projects through our 5 work groups that comprise the GYC, including the Mental Health Work Group and the Substance Abuse Work Group that we'll be seeing today. Today, we're so excited to be hosting our first ever overlap of substance abuse and mental illness in our schools. We've got a wonderful panel of speakers here to share insight and strategies to help address these challenges. With that, I'm excited to be welcoming Emily from Sedona.
Thank you, Diesel, and thank you to ASU Preparatory Academy for hosting our event today, and the Governor's Office of Youth, Faith, and Family staff for helping to put this together. Good morning, everyone. Thank you for joining us for Stranger Together, hosted by the Governor's Youth Commission. My name is Emily, and I'm a senior from Sedona Red Rock High School and a commissioner on the GYC's Mental Health Work Group. Today, in collaboration with the Substance Youth Prevention Work Group, we'll discuss substance use and its correlation with mental health among youth, including prevention strategies for parents and youth, actions youth can take, and more. We are grateful to have a room full of incredible students, parents, and community members. Before we start our panel discussion, I'm excited to now introduce Malia, a senior from Prescott High School, to welcome and introduce our first panelist.
Thank you, Emily. Our first panelist is Sergeant First Class Deb Stoks. She has served in the National Guard for 17 years and is a certified instructor for the military police. For the past 6 years, she has been a member of the Arizona National Guard Counter-Drug Task Force, specifically the Drug Demand Reduction and Outreach Team. At the Governor's Office of Youth, Faith, and Family, she provides strategic prevention knowledge and technical assistance with grant writing by coordinating quarterly workshops. Additionally, she serves as an instructor for SAMHSA's Strategic Prevention Framework Application for Prevention Success Training and the Primary Prevention Advanced course, both hosted through the High Intensity Drug Trafficking Area. I'll hand it off to Luke, a sophomore from Brophy, to introduce our next panelist.
Thank you, Malia. Our next panelist is Kristina Sabetta, Executive Director of the National Alliance on Mental Illness, Valley of the Sun Branch. She is a licensed master's level social worker and a faculty associate in the social worker department at Arizona State University. As a nonprofit executive consultant, Kristina has a track record of helping nonprofits succeed and currently provides consulting services in nonprofit management, executive leadership, behavioral health advocacy, and education, and program design and implementation. Finally, Sneha, a Basis Awatuki senior, will introduce our last panelist.
Thanks, Luke. Our final speaker is Yesmina Luchsinger, who works with Sergeant First Class Stoks in the GOYFF. Ms. Luchsinger is an educator, mental health professional, and gun violence survivor. She brings experience connecting education and mental health systems of care, policy development, and prevention. Before joining the GOYFF, Yesmina worked to support providers, educators, caregivers, and policymakers across the nation with the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health and the Arizona Department of Education as the Director of School Safety and Social Wellness. I'll hand it off to Palak, a senior from Rio Rico High School, and Amelia, a senior from Basis Oro Valley, to get our panel started.
Thank you for those wonderful introductions. Before we begin the panel discussion, it's important that you realize that today's topics may be activating or stressful if you or someone you know is dealing with substance use or mental health challenges. We encourage you to prioritize your well-being and take a break if needed. Feel free to return when ready. If you require additional support, or if you or someone you know is contemplating suicide, help is available and healing is possible. The National Suicide Prevention Lifeline is available by calling or texting 988.
And at that, I think it's time to start our panel. The final 15 minutes of today's panel will be open to questions from you, the audience, so make sure you save your questions for the end. Thank you to the three of you for taking the time to be here today and sharing your expertise.
Okay, so let's get to know each of you a little bit more. Sergeant Stoks, we'll start with you and then move on. What drew you to substance use prevention work?
Well, first off, thank you for having me. So a few things. First off, I have a medical background, and so I worked in the ED, I worked in cardiac, and so I really saw firsthand what substance use and behavioral health does to a person's body. So I kind of want to do first full circle of seeing not just intervention, I kind of want to be focused on prevention side to prevent them from going into that side, to be that medical attention that can be life-saving. I want them to avoid that. I lost my dad September 28, 2020 to an overdose. And so I think that really kind of lit my passion as well of why prevention matters. So that's kind of my big reason, so I'll pass it on.
I love that. Thanks for sharing. My reason for being here is really personal. So I, as many of ours are, so I have been living with depression and anxiety most of my life. At the age of 20, I was diagnosed with bulimia. At the age of 24, I was actually in my master's class. I was in the front row because I was actually a really good student. And I had passed out. I was so malnourished from my bulimia. And so I had a fellow student who took me to the emergency room. And when I came to, I realized that while I was already in the field of social work and I knew what I wanted to do, I also knew that I wanted to share my story and let folks know that they're not alone and others are dealing with this, and do what I can to really decrease the amount of loneliness and mental health issues that we have amongst our youth. So that's really why I'm here. I'll do this forever because of my personal experience. I'm grateful to be here and be alive. I don't think I would be alive if I was 20 now. And so you guys have you're in a tough place. So yeah, that's why I'm here, and thank you for having me.
Thank you, everybody. Thank you for inviting us. My reason for substance abuse prevention and mental health prevention is also personal. I lost a parent to homicide by gun when I was 5, and that has impacted my life incredibly, as you can imagine. But the young people who took my dad's life were on their way to rob a liquor store. And so the overlap there for me is why I wanted to be doing this work, so that I could do what's called upstream prevention, and we'll talk about that later, and impact the conditions of our environment so that no one has to lose a family member, and those young people have an opportunity to make better decisions.
Thank you all so much for sharing your stories. Obviously, it's very personal, and we're really grateful that you guys are here. I'm looking out into the audience and looking at all the youth here. How do you think we can help young people correct their misunderstandings about mental health? Some people believe that having emotional struggles means that they're weak and that they're vulnerable. Others think that having these feelings will go away when they get older. Do you think this is true? Do you think there are certain misconceptions about this? And how can we tackle these ideas?
So one of my biggest things when it comes to mental health within youth, and I know hopefully we'll have time to talk about it later, but obviously social media is a big one for me, because it's constantly in their face. There's this misconception that they're weak, but it's not, right? And I think something for youth, and it's for really young adults, anybody, we just need to be kinder to each other because life is hard enough. So I think that's how we can really break that stigma, is let's just be a little kinder to each other, right? To break that stigma and let people know that we could have similar situations. I share my story because there may be somebody else who have gone through the same thing, who are currently going through it. So hopefully by me sharing it, it lets them know that you're not weak and we've all gone through it and we can support each other.
So I really feel that seeking help is a sign of strength. It is absolutely not a sign of weakness. Weakness is not talking about it and pretending nothing's wrong. Getting out, reaching out for help is a sign of strength. I think by sharing our stories with each other, letting folks know that they're not alone. When we hear from a peer who's considering suicide, we let them know, hey, I hear you. Like, I'm here for you. I've struggled with that myself, right? We are not alone. And I think the other thing I would say about that is really making sure that we are continuing to have the conversations. We are in a mental health emergency. It should be a national emergency. We are in a mental health crisis. It's ridiculous. And so the more we talk about it, the more we lift each other's up, the more we be aware of the comments we're making on social media, the more aware we are of the comments we're saying to each other. As parents, the way we are to see what kind of pressure we might be putting on our kids and understanding that. And I think for you as students, understanding the amount of stress and pressure that you're under and finding those tools and coping skills that you can utilize to help with that stress, I think is really crucial.
I don't know if we're all supposed to answer every question, but this one's one of my soapboxes. I have mental health and so do you. The only people who don't have mental health aren't conscious or aren't alive. And for me, part of breaking down that stigma is helping everyone understand that mental health is part of your entire physical being. And to expect that your entire life you're going to go and never get a cold, or never break a leg, or never have some other physical illness, I don't expect that, do you? Okay. So it's pretty likely that sometime in our life, we will have some type of challenge that will impact our mental health. If it hasn't happened to you yet, you're very lucky, and you can learn how to help somebody else. But if it has happened to you, congratulations. Now you have a little bit bigger toolkit of how to help yourself and help someone else. And you might have discovered that what society is telling you is a mental illness is actually your superpower.
Thank you for those amazing answers. Kristina, can you share some trends that you're seeing with mental health issues among young people?
Yes, we're seeing a lot of trends. So increasing feelings of sadness and loneliness, especially around teenage girls. We've seen an increase from 36 to 57%. That's huge. That's huge. Rates of anxiety, of clinically diagnosed anxiety has increased by 35%. We know that we had a mental health crisis going into COVID, and that just exacerbated things so much more. We have teen reports. We have teens reporting higher levels of stress, social situations, future uncertainties. Now's a scary time for some folks, not knowing what the next year will bring, especially with our political environment. Eating disorders are up. We're definitely seeing an increase in eating disorders. A lot of competition between college admissions, right? Stresses, high stakes testing, schedules with stress. My son is in 4th grade and he's going to be taking his test pretty soon, right? And there's all these directions to bring snacks in and make sure they get plenty of sleep. Honestly, I tell my son, honey, just be happy and do the best that you can. And then, of course, with our LGBTQ youth. And so we have, recent data shows that 24% of our gay or lesbian students have considered or have attempted suicide, 24%. And so they continue to see a high increase in suicide rates there. So those are some of the things that we're seeing.
Yesmina, I see you nodding along with our panelists here. Do you have anything else to add to that?
About trends we're seeing?
Yeah.
Well, one of the things I also think that we're seeing, and Kristina, you highlighted a lot of the data and numbers about the increases in use and depression, but we also are being not confronted. We are welcoming in a new generation of young people, young adults, future leaders that have access to technology, tools, and connection that we never had before. So while there is, as Sergeant First Class Stoks shared, a lot of downsides to social media, some of the other trends that I'm seeing are easier to access substance abuse support platforms. We have easier to access tech support for folks who are thinking of suicide. We have apps now that can help you identify medications. We have increase in funding in harm reduction programs that don't just talk about abstinence only. We have the increase of social emotional learning programs for kids starting as young as kindergarten. So while we have a lot to be concerned about, we definitely do. The Surgeon General has said we are in intersecting crises of mental health, and the previous Surgeon General also said we're in a crisis of systemic racism. And those two things, that intersectionality is something that we need to look at and we need to talk about. But we also do have a lot to be hopeful for, and a lot of resources that I didn't have when I was in school. We just need to figure out how to leverage them in more positive ways.
And Sergeant First Class Stoks, I know you brought up social media and the effect social media can have on mental health, on youth health. How do you think youth can develop a better relationship with digital platforms and use it for the better?
Yeah, so this is something I can actually talk for hours on. I really can. I'm very passionate about when it comes to social media and youth, just because of the extreme dangers that are on there now. And so, just to preface, right, there's really good things. Like, social media is made to be good, right? To connect with your friends, connect with your family, play fun games, take fun pictures, right? But sadly, there's really bad people in this world, and they are targeting youth. And I'm saying that because I've seen it firsthand. I work with law enforcement agencies and we're seeing this. And there's grooming, sexual exploitation. That's something that really goes into mental health too, is you're constantly seeing these, you're scrolling and you're seeing these diet pills. And these girls are saying, this is how you can be skinny, right? And then you have people picking on each other. So you have bullying, not just in schools, but now they have to go home and see on their social media, on their phone. So they're getting bullied 24/7, right? And that's affecting our youth's mental health. And so something that I would advise for you is to try to limit that time, right? I know it's the cool thing to do, you know, be on Instagram, see everybody's doing, be in the know, but we need to do it in a healthy manner, right? So kind of set our own barriers. I even do it for myself, right? At my phone, when I get home, 6 o'clock, my phone goes away, right? So if there's certain messages, right, if there's something emergency that comes up, yes, I'll obviously respond, but no social media, right? That's just a limit that I've had to myself because it happens, right? We all get in that kind of doom scroll, right? You just start seeing things, you're like, oh yeah, funny, laugh, this is great. You see some really great things, but then you also see some really bad things. So for youth, I really challenge you to try to limit yourself for your own protection. Just because sadly there's really bad people out there who are wanting to do really bad things. And so protect yourself, protect your friends too, encourage just safe use, right? Just use it for good things. Sadly, it's really easy to go on there for youth to find a dealer, to order that pill, to have it delivered to your house, right? It's so easy and it's so frustrating. in my realm, because that's who we're battling against. So the accessibility with substance use and mental health on social media, it's way too easy, so limit yourself. That's my biggest suggestion to you. And if somebody does try to approach you, if there's some negative activity, block it, avoid it. I'm that tattletale on social media. If I see something that's safe or that's dangerous and not safe, I'm reporting it. Every chance I can, I'm reporting these people just so that you guys aren't seeing it, because you shouldn't be seeing it, right? We didn't have to see all that you guys have nowadays on social media. We didn't have that. But you guys are seeing this stuff 24/7 through your phone. So just be conscious of it. Know that everybody's not nice. People don't have good intentions out there. So if somebody tries to fall into your DM that you don't know, don't respond, block them, right? If you don't know them, don't talk to them. They can go down a really bad path, okay? Just protect yourself.
Thank you so much, Sergeant Stoks, for your insight. I've personally fallen susceptible to that doom scrolling. Yeah, I mean, social media has changed so much about the way that we connect with each other, contributing to various different risk factors among young people. Yesmina, can you explain how different risk factors, such as adverse childhood experiences, ACEs, or social determinants of health, like a person's living environment, impact growth and learning?
Yeah, can you switch the slide? I was going to hang this out, but it would have been too small for you to read. So this is actually, how many of you who are here have heard of adverse childhood experiences before? Okay, so a lot of you. How many of you have heard of positive childhood experiences? Only a couple. Okay, great. So when we talk about adverse childhood experiences, we talk about those things that happen to you or the circumstances of your environment that impact your long-term health. That was the original study. And we've also been talking more lately in our dialogue about historical trauma. So this is actually my tree. Deb, can you point to the key in the bottom? Yeah. Okay, so the little leaves here are people in my family history. So someone in my family history experienced divorce. I also experienced divorce. Oh, I'm so sorry, you guys don't have to move. Multiple members of my family have experienced war or intimate partner violence. And these are all things that make up who I am and make up who my family is. And we know now from current science that trauma can actually influence the way our genes look and connect at our DNA level. So I like to think about that as the roots and the soil. But we are not just the roots and the soil, we're also the sunshine and the air. And so up here are the positive life experiences that I have that have protected me from some of those adverse outcomes. So even if you're a person like me who has a really high ACE score and sometimes get bummed out by that, I did have a lot of positive experiences in my life that protected me from some of those health effects. So I was involved in sports, see belonging. I had a family that cared about me and was involved in my life. I lived in a rural community. Within that community, I had access to great public schools and teachers that cared about my development. And I also had a spiritual community that I could connect to. Those were all things that reduced the impact of some of the negative things that happened in my life. You can go to the next one. So when you hear people talk about the social determinants of health now, these are the things, the various environmental factors that influence how long we live. And so I group them into environment, where you live, your access to resources, your exposure, either positive or negative, and then the community that you live in. So you can see up in environment, you see positive and negative childhood experiences. That's only one small part of your long-term health. All of these things need to be working together in order to improve health outcomes. So jobs and living wages. If you live in a community where you don't have access to jobs and living wages, can you have a house to live in? Can you, if you don't have a car, you can't afford a car, how are you going to get to those appointments? If you don't have access to quality health care, you know, the US has a high maternal mortality rate. All of these things have to be working together to improve outcomes. I think that's pretty much it. You guys can come sit back down. Yeah, you're welcome. But there's also ways that we can grow. So in the bottom you have exposure to culture, exposure to opportunity, exposure to support and care. Those are all things like positive childhood experiences that can make our lives longer, make our relationships richer, and make this experience of living more worthwhile.
Thank you so much. That was so insightful. Kristina, what are some signs youth and parents should look for to suggest that they might be struggling? And how can we best approach the topic with a loved one, especially a young person?
Awesome, great. So I made a couple notes here just so I don't miss anything. But withdrawal from friends or family, right? So if you're seeing someone on a regular basis and you don't see or hear from them for a few weeks, like check on them. Let them know if everything's okay. If they broke their ankle, you would probably check in on them and see if they need help with the door as they enter the classroom, right? It's no different with a mental health issue. Changes in sleep, so sleeping too much, not sleeping enough, definitely signs. Shifts in eating habits, so gaining a lot of weight or losing a lot of weight, especially really quickly. Decline in academic performance, loss of interest in school, so they're doing really well, they're part of your group work, and they're no longer contributing. Or you see them struggling to pass. You see them sort of dazed and confused in the classroom. Increased irritability, anger, mood swings. Irritability is always my big one. My husband always knows, all right, honey, it's time to go to the gym. Because I get really irritable in the evening when my depression is bad. Expressing feelings of hopelessness. I can't do this anymore. I'm not going to be able to survive this. Obviously talking about suicide and having a plan. We all know that suicide is a permanent solution to a temporary problem. Just because we're feeling bad one day doesn't mean we're going to feel the same way the next day. Talking about death or dying, self-harm behaviors or cutting. Let's not ignore that, especially as parents. We need to talk about it. We all know you're talking about it a lot, but our trusted adults that you have, are they able to talk about it? And then risky or impulsive behaviors, doing something that they normally wouldn't do, is something to pay attention to. So what I would say for someone that's struggling, we want to have that conversation about it and let them know, how are you doing? Just create a safe place, calm, non-judgmental. You seemed a little off lately. You seemed a little different lately. What's going on? It may not be anything. It may just be that they're dealing with some stuff at home and it's throwing them off a little bit, but it may be a mental health issues, right? And to your point, right, we all have mental health, and some of us are going to have some bad days, and some of us are going to deal with some depression and anxiety from time to time, but when you see it continually happening, and you see it for longer periods than a few days, we usually sort of think about 2 weeks. About 2 weeks, like we need to maybe take a look at that and get them checked into. So I think just letting them know you care, letting them know you see something different, and then just stop and listen and let them speak.
Thank you so much to all of our wonderful panelists for their amazing insights. I know I learned a lot. How about you, Amelia?
Yeah, definitely. Yeah, definitely. Yesmina, I'd heard of adverse childhood experiences before, but never about positive childhood experiences. So I definitely learned a lot from that. And then also just the way we connect on social media and all the different statistics that you shared. Kristina, were really insightful.
Okay, so now let's open up the discussion to questions from the audience. So now if you have any questions, feel free to ask.
Go for it.
All right.
Yeah, shout it out.
So we talked about social media and stuff, but as parents, how would you go about that? Would you give your kids social media? Is there an age that you should put it on there? Is there, like, how are you supposed to dictate what they're allowed on and what they aren't, as students and as parents?
That's a great question, and you might have a different answer, but I'm going to refer to something my dear friend Katie McPherson will tell you. She's a huge advocate, and she will say, once you're okay with your child seeing pornography, then it's okay to give them a phone and have that social media.
Yes, and that's a realistic, something that I always recommend for parents. There's two things. It's called Child 2.0. It's a documentary you can find on YouTube. Watch it. There's also another documentary series called Undercover Underage. Both will terrify you as a parent, but it's also very knowledgeable to know as a parent what your kids are seeing on social media. So like you said, right, it's that age. If you're ready to allow your kids to see pornography, drugs in their faces all the time, if you're ready for the time, right, that's how scary it is. So as parents though too, there's also quite a few apps, third-party apps that you can find, Apple and Android, that gives those limits that you can limit their time and track what they're seeing as well. So obviously, right, kiddos, don't hate me, but you'll thank me someday, right? It's good, right, for your parents to be more aware and to kind of track that time, because in the long run, it's going to help you out to avoid seeing the harms that are on there.
And as you move out of your parents' house and maybe use some of those apps that are for dating or meeting people, be safe. Just be safe. Tell people where you're going. Give your location on your phone. Don't meet somebody for the first time in an isolated place. And let people know where you are. Don't ignore basic safety just because a person seems chill.
Can I just, that's such a big question, right? We could spend all day talking about that, but if I can just add one more thing to that, and I think it's really, for parents, it's really significant to take a look at generations. And we made much worse choices during our generations. From drinking and smoking and having sex, getting drunk in the cornfield and driving home. Like, the choices we made were much worse than the choices that are being done right now. And so I hear from parents a lot, what I'm not as concerned about, do you know what I did when I was a 20-year-old? I'm seriously not as concerned about my kid because they're home. Well, where are they? They're in their bedroom on social media. You should be much more concerned about your loved one and your young adult being in their room completely isolated on social media than you would be like us in the cornfield. But just something to be mindful of. Generations have changed and we need to be aware of that.
I want to open it back up to the audience if anyone has any other questions. Yeah,
Wondering if a child doesn't have a super great support system at home, what are some things that schools can implement to help children maybe struggling with depression or anxiety?
Great question. So I will start off by saying I think I really value having social workers within the classrooms. I really value peer support. We hear from youth over and over again that they have 3 social workers at school, but they're not going to go to them. So I love having peer champions in the classroom who can recognize that. At NAMI, we have Ending the Silence, where we go into middle school and high schools and talk about mental health, suicide, and how as peers we can reach out to a trusted adult and have that conversation. And we see more lives be saved with that peer-to-peer support. Even though I'm a social worker and I think that's important, we still need to have those trusted adults, but we need to have that peer who's educated and aware enough of what they're dealing with who can make that connection. The other thing I would add to that is we hear from educators a lot when we come in and do a presentation around mental health. They're like, oh, you know what? I was actually really worried about this kid, but now after hearing from you, I'm much more worried about the kid in the corner who's not talking to us. So really making sure we can't all be mental health experts, but we can all have a basic knowledge and understanding of what to look for, what to keep an eye on, and then know when it's time for us to encourage them to get help.
I would like to talk about this for the rest of the afternoon, so please buckle up. There are so many things that you can do. If you're a young person, I think that, or a young adult, I think that you have the most ability to impact policy change way better than an adult. So this is my call to you. Show up at your school board meetings. Tell your school board that you would like more mental health supports on campus. If that's something that you need. Because those are the folks that are there to make sure that your educational needs are met, and that's part of your opportunity to be civically engaged. There are tons of programs and practices and interventions that we have that are available that we know work, but getting them in the door to schools is often difficult. So I do agree with Kristina 3,000%. That young people are the change. You can start peer support programs. There is a peer mediation conference that happens here in Phoenix every year to teach school-based peer mediation groups. There is the Stand Up Speak Out youth event that happens here in Phoenix every year, and maybe we can start getting it going all over the state. Sedona, where you at? We need to take it to our folks in rural areas. And so I think that one of the best things that you can do is to let the adults in your life know what you need, and know that you are the leaders of tomorrow, and the adults are much more likely to listen to your needs than they would be to someone who doesn't go to school there, that's outside. You have a lot of ability to impact change.
And I'll just quickly emphasize something that I said earlier, is just we need to be kinder to each other. That's the biggest thing for peer support, especially in youth, is just be kinder to each other, because you don't know what their home life is like, you know what challenges they're going on, you know what medical challenges that they're going through, you know, your hormones as you get older, they're changing, right? So youth just struggle with that, right? Something new. So we have to be there for each other and be kind to each other. And I know it's weird coming from somebody wearing a military uniform, it's supposed to be like all hard and stuff. But I encourage it within my own ranks that we're humans, right? We all have mental health. We need to be kinder to each other and be there for each other.
I want to leave it open for one last question. Yeah, the block.
You guys mentioned earlier about some outside factors other than friends and family being contributors to social anxiety, things like politics. Do you guys see any sort of correlation between politics, like housing prices going up for younger people in the future, other outside factors like possible war or something else going on with politics? Do you guys see any correlation with that and rising stress levels in the future and depression?
Yes.
Yeah.
Absolutely.
Yeah, I know you guys can all speak on it too. Obviously, you mentioned war and stuff being the military, right? So, like, I see it within my ranks. I see it within their children, right? Who are all school-age children at my age now. So, of course, it's going to be there that their parent may have to go away for something, right? So, it is a real factor that can play into it. Politics, it affects everybody. Especially, there's a lot of changes happening right now. And so that's why we have to be there for each other, support each other because of that, right? And so we have to kind of get rid of all that hate that's happening, and we need to be together because those higher changes, right? We just have to support each other during this change, right? We have no say in that, so we just have to be with each other.
Yeah, I mean, we see a direct correlation. We're definitely seeing levels of stress and anxiety go up. You know, I think that having gone through this last week, and some of you saw the billions of dollars that were cut, we lost funding for a program within our schools, the Ending the Silence program that I mentioned. And I spent hours just bawling, thinking like, oh my gosh, I'm so scared for the future. Like, these youth need this more than anything, right? And I really had to use my coping skills and my resiliency skills that I've learned over the years to understand, like, okay, we're gonna be okay, right? I found a donor, I saved my program within a few hours. I was very blessed that I was able to do that, but I'm not going to stop bringing mental health education to the schools. That has to continue to happen. So there's a lot of fear. I mean, it's a lot harder to buy a home, to rent, to buy supplies. I mean, I just had my stepson move to Texas because it's like, I can't afford to live here. And I'm also not, I'm gonna start somewhere fresh, right? Where I can have an opportunity. So it's a sad, scary situation. I think if you look at history, we've been in similar situations like this before, and we can get through this. We're gonna be okay. We're resilient folks. We are talking about it more than ever. We're gonna be okay. So it's really, you know, coming back to sort of being kind, being understanding, but also recognizing that at times we just need to stop and deal with the stress. You know, my kids saw me crying the other day. I'm like, but you know, mommy sometimes just feels better if I can just cry for 30 minutes, right? I'm like, oh yeah. I'm not going to the liquor store and opening up a bottle of wine, or not the first thing I'm gonna do when I come home is open up a can of beer and be like, I'm gonna survive this, right? I'm like, no, mommy just needs some time to cry. I'm gonna go to the gym, I'm gonna go for a walk. So I'm not really answering your question, other than we're definitely seeing a huge impact, and I think we need to rely on our coping skills and our resiliency skills now more than ever.
I love what you both have said because it is so true. And I actually want to wrap, well, could you put the social determinants of health back up? Here we go. So when we're seeing like some sort of struggle in one area that we don't have control over, actually this is something I talk about in my own personal mental health support sessions, like when we don't have control over some of these giant things, like we don't have control over jobs and living wages, we might not have control over the zip code we were born in. Like, did you know that folks can predict how long you'll live based on the zip code you were born in? Like, just that alone, give me that information and I can get you pretty close. Because that's how much our environment impacts our health. So we really have to zero in on the things that we can directly control and the things that we can directly impact. And one of the things that we can directly control and directly impact is the amount of exposure to violent imagery and to some of the rhetoric with what Sergeant First Class Stoks was talking about and Kristina, with limiting our own exposure to those images. And I can say, and I'll just say personally for me, when the war overseas started that was impacting my family, my social media news feeds became 24-hour updates about the war that was happening. And it caused me such a great deal of stress that I was able to recognize, because I'm from a generation that did not have social media growing up. So I was able to recognize that since I started doing this, I'm having physical health symptoms. I had to go to the doctor because I thought my arthritis was out of whack, and I started having migraines again. What it was the physical manifestation of the images that I was putting in my brain, and when I stopped looking at them, my migraine stopped. And it's not always that direct, but it didn't mean I didn't care about what was happening. It didn't mean I wasn't still active about what was happening. I was still calling my family. I was still doing what I could. I just realized that it didn't mean I cared less about it because I'm not torturing myself with the images. You can still care about something and not have to be updated about it as much as society tells us we need to be. It's okay to only check on it once a day or once a week. I give myself permission, and then I work on the things within my realm of control, like creating support and care circles for myself, engaging in those spiritual activities, making my home safe, and making sure I'm eating healthy food. And that's all I can do.
Thank you all again so much for your insight and for being here today. With that, our Q&A session is closed, but I did want to ask one quick last question. If you guys could share one key takeaway on how schools, community, organizations, and families can collaborate to foster support for and create supportive environments that prevent substance use, assist young people facing mental health or substance use challenges, and encourage open, non-judgmental communication, what would it be?
Yeah, one is always tough. I would say you are not alone. You are the ones in the classrooms with your friends on social media. You are the ones saving lives. We are giving you the information. We are showing you and the teachers in the schools what works. We are showing you what the evidence says. We are watching trends. We are following research. But you are the one that are saving lives amongst your youth, amongst your peer group. So know that you're not alone. Remind your peers that they're not alone. There's a lot of support that's out there to assist you. And at the end of the day, no one deserves to live in that darkness. No one deserves to live with the depression and anxiety. I've tried many, many things. And I'll always follow certain things like medication and hiking and things that make me whole and that keep me in a good place. Yeah, I would say at the end of the day, just you are not alone. Remind your peers of that because you're the ones that they come to.
I will say my one thing is a story, since we didn't get to tell it. It's about a group of people who are fishing in a river. And one day in the river, they notice that there's a child and they see this child drowning. So someone jumps into the river to save this drowning child. But then they notice another one's coming and another one's coming. And pretty soon there's all these people who are jumping in the river. They're getting exhausted because all these kids keep drowning. And in my story, I always say it's a woman, it could be anybody. In my story, a woman looks around, she gets up, and she leaves, and she walks upstream. Everyone who's still in the river is angry and upset. Why did she leave us? We're trying to save all these children, they're drowning. pretty soon the number of children drowning stop, and the woman comes back and they're like, why did you leave us? What was up with that? And she's like, well, I noticed that all these kids kept drowning in the river, so I walked upstream, and the bridge that they used to get to school had a hole in it. And so we fixed the bridge. So my thing would be upstream prevention. We see a lot of bad things happening, substance use, kids having thoughts of suicide, kids dying by suicide. We need to get out of the river and collectively walk upstream and fix those things. It's hard and people will be upset, but we'll fix the hole in the bridge and things will get a little bit better.
What you both said were pretty spot on, and I think it's amazing, and something that I kind of mentioned earlier is being open about our own, right? So this literally happened this week. I talked to Yesmina, we had a meeting, and I said, I am mentally unwell right now, so I'm taking tomorrow off because I need to focus on me. I need a brain break, right? Because we have, like you mentioned earlier, we have political factors happening right now, especially being in the military, right? So I'm working 2 jobs. I'm working military side, I'm working at Governor's Office of Youth and Family. I'm doing as much as I can to help the community, right? To kind of save kiddos. We're talking about death all the time, right? It can get very heavy. I realized that, and I told Yesmina, and she supported me. She said, absolutely, I got this. Yes, so it's okay, right? You have your team, but you gotta be open so that they can understand and also help you. What we were working on, she handled it, and she knew that I just needed a moment, and I gave myself a day to get myself back in order, and I focused on me. I went on a hike outside with my dog, and just kind of reevaluated what I needed to kind of prioritize moving forward. But you have to recognize that, and you have to support each other and have a good team, just create that good team around you and be open about it. It's not shameful, it doesn't make you any weaker when you have that, but recognize it and share with others. It's okay, they'll support you with it.
Thank you three again for dedicating your Saturday afternoons to sharing your insights with us, taking the time to be here today, and sharing your valuable expertise. That wraps up our Q&A panel for today, so let's give them a final round of applause.
Would you all like to bow? Yeah, definitely. Let's do one last final round of applause and you guys can all bow. So as we close up our event, we want to thank everyone who joined us today. Please remember that your presence here today and the knowledge you gain from our county partners can significantly impact each of your own individual communities. Through cross-sector, multi-agency, data-driven, and solution-focused initiatives, we continue to break down barriers, providing critical resources and services to those who need them most. And most importantly, we're working to create an Arizona for everyone. As a reminder, please take some time to look at the incredible resources from each organization at the back tables, and have a great rest of your Saturday. Thank you all.